I'm Elliot Mattingly with KORT Physical Therapy. I'm a physical therapist here at KORT Bardstown. And today I have with me Dr. Mark Duber, and I'll let him introduce himself.
Yep, I'm Dr. Mark Duber. I'm an orthopedic surgeon here in Bardstown, specializing in multiple joint replacements, and today we're going to be talking about hip replacements.
Yeah, awesome. I'm excited to have you guys with us.
All right, we'll get started out with questions. The first question, how do I know if I'm a good candidate for a hip replacement?
I'll let you tackle that one.
Yep, so most people know they're ready for a hip replacement once, number one, they failed the conservative care that's involved to get to the point where we discuss if it's surgical. They're having pain every day, it's affecting daily activities, it's affecting sleep, and I would say mostly, your life's just affected in a negative way, and that would be the next step to improve your pain.
Yeah, it's interesting because people who present and need to have a hip replacement, they have pain in a different spot in their hip. Tell us about that a little bit.
Yeah, so there's multiple places you're going to get pain in the hip. In arthritis, you're mostly going to get pain in the groin area or the front side of your thigh. Then there's other types of pain in your hip that's not arthritis. For example, pain on the outside of your thigh. That's usually a bursitis. It's an inflamed fat pad that's very, very common. Probably the most common complaint for hip pain. Sometimes you get pain in the back of your hip. That can be related to different parts of the pelvis area, as well as more pain that's coming from the spine. But in this case, when we're talking about hip replacement, it's more the pain in the front of the thigh or the groin is what we're looking at.
And that's what we see too. And we'll try to work with these patients to get rid of that groin pain in the front. And if we are struggling, we can't make that change. That's when Dr. Duber comes in and he gets to help alleviate that pain immediately, which is pretty incredible.
Mm-hmm.
The next question is for the both of you. Is there anything I should do before my surgery to prepare?
Yeah, so to prepare, number one, from my perspective as a surgeon, it's about the conservative care to make sure that we've met that before the surgery. And there's two reasons for that. Many people do well with just conservative care alone and don't need surgery. And outside of that, we need to meet the conservative care so that insurance will cover the surgery if it's needed. So really, conservative care is very, very important. And that includes physical therapy, number one, anti-inflammatories if you can take it, activity restrictions, possibly use of a cane, and other things of that fashion. But that needs to be met so that we can actually get insurance approval. But like I said, a lot of times it helps enough that you don't even need the surgery.
Yeah, that's nice. So what we utilize is a program we call Rehab. And what that means, you're just doing therapy before a surgery. And usually what Dr. Duber will do, he'll send us over here and he gives us the opportunity to try to get you better before having surgery. And sometimes, like you said, you don't need it. You get to push it off a year or two. It really helps you get some of your motion back, your strength back, and just get your life back. But if that doesn't help, then you've worked on your strength and your motion, and then you're going to be more successful in your surgery anyway. So it seems like almost counterproductive to go to therapy before you have surgery or you have therapy afterwards. But the point is, it cuts down on the end result. Absolutely. If you go through and you get stronger before, you're going to be out faster afterwards.
Yeah, and just to add too, there's other conservative care modalities that we do outside of the ones I mentioned just a second ago. Sometimes we actually do some injections in the hip joint themselves using an x-ray machine, and sometimes that can buy you 6 months at a time. And if that works, we can repeat an injection until they stop working and then do the surgery. But there's lots of options outside of surgery.
Yeah, what I like about that one too is like when you do that for a patient and it makes that positive change, like it gives me the confidence that when they do, if they need to have a surgery,
absolutely,
they're going to do so well with it because it took away their pain.
Yeah, and I like injections a lot of times before hip replacements anyways because I can show that all the pain is coming from the hip joint. Because if they don't have a lot of pain after the injection, then we know when they're ready for a hip replacement, we're going to be very successful and it's going to take the pain away that they're having.
Huge confidence boost.
The next question for Dr. Duber. Are all hip replacements the same or are there different types?
Actually, there's many different types of hip replacements. I would say mostly the implants are similar that we use, but the difference in today's day is how are you doing it from a perspective of where's the incision being made. So if we went back about 20 years ago, 30 years ago, most of the incisions were in the back side of the thigh, okay? They had a lot of problems. They had a lot of problems with weakness and prolonged recoveries. There was more of a risk of dislocation. There was more a risk of leg length discrepancies, one leg being a little bit longer or shorter. Then things kind of migrated more to the front. Then they went to the side of the hip. That improved certain of those problems I just discussed. But I would say in current day, most hip replacements by most people doing modern surgery is from the front. Okay, we call those anterior hip replacements. I've been doing anterior hip replacements for over 6 years now, and I've done hundreds of anterior hip replacements. There's no question that it's a much better way to do it, especially in my hands, because the pain's less, the functionality's quicker, the recovery's much quicker. I've got many people that you do an anterior hip replacement, and I always use someone who works at Ford as an example, because they're on concrete all day, they're working with machines. I've got many people that I've done anterior hip replacements on, and they're back at work without restrictions in 6 weeks. Now, from a posterior or backside approach, there's sometimes it would take 3, 4, 5, 6 months to get someone back to go do those types of jobs. So I would say yes, things have changed a lot. The anterior hip replacement or the hip replacement from the front is definitely improving patient satisfaction, patient's recovery, and the overall effect of what we're doing.
Anytime we can make it easier on the patient, easier on the surgeon, that's going to make it easier for therapy too. A lot of times therapy has this negative connotation after a surgery that it's going to be painful and uncomfortable. It's not. After a hip replacement, we get to improve your motion and you get to build your strength. And like you said, people are getting back really quick. I'm so glad that he does it here in town, just because it makes our jobs a lot easier, but he's able to serve our population here in Bardstown and surrounding counties, and does a fantastic job at that.
Yeah, and when we do an anterior hip replacement, or I do one, people are walking on these hips within an hour and a half of me doing them, usually with less pain than they had before the surgery. That's how successful the anterior hip replacements are.
Dr. Duber, you've touched on this, but can you explain what you do during surgery and a hip replacement?
Okay, so basically we'll talk about the components of a hip replacement. So when I do hip replacement again, I do all my hip replacements from the front, or also known as an anterior hip replacement. There's multiple components to that. So I'll use my hands as my models, since we don't have models here. You kind of have a ball and a socket. So in a hip replacement, we replace the ball, okay, and we replace the cup. The cup has 2 components. One is a metal liner that goes in that the bone actually grows into from the actual body. There's no cement. Inside that metal cup, there's a plastic liner, okay? And I will say, with exceptions, sometimes if someone's very young, we have a hip replacement, we can actually do a ceramic liner in there, which has more lifespan to it. And then in terms of the ball, we remove the old ball that's all beat up and there's no cartilage remaining on it. Then we put a little stem that's actually probably about that big. It's not actually that big. It's made for an anterior hip replacement or one from the front, and it goes into the actual femur bone at the top. And then we replace the ball, and the ball is actually a ceramic ball in all my patients. So the 2 choices are a ceramic ball and a plastic cup, which is probably about 95% of the ones we do. And the other option is a ceramic ball and a ceramic cup, okay? And I'll just give you some more information. So if we look at what we expect to get out of these new replacements, the ceramic is really the key, and the plastic. That's where all the technology is right now. In a typical hip replacement with a ceramic ball and a plastic cup, we're hoping for about 30 years of duration of that implant. And a lot of times we can raise it. If we go to a ceramic cup with a ceramic ball, then we're looking more at 40 years. So most of the indications for the ceramic on ceramic is someone who's very young for that surgery. Most people at typical ages, the ceramic ball with the plastic cup will last pretty much the rest of their life for the average patient.
Yeah, that's incredible.
Next question. Do I have any restrictions on what I can and can't do after surgery?
So after surgery from an anterior hip replacement, we have very little restrictions. We actually mostly make people weight bearing as tolerated. So in terms of daily activities, go for it. You can do daily activities right away after an anterior hip replacement because we're not concerned about dislocation and other things as much as we were back when everybody was doing the ones from the backside. So the only thing we do is we basically don't want people running, we don't want people jumping, because that's just more just getting the surgical pain. There are people that have done some light running on hip replacements. We still don't recommend it too much, but some people, they may be able to do some of that. But most of it's daily activities. So you're cleared for daily activities pretty much immediately after we do that surgery and you're discharged.
What's nice is it's more of the surgical precautions that we don't have to worry about anymore. When you do surgery from the backside, like you couldn't cross your legs, bending over, all these different things because you're at risk of a dislocation. Mm-hmm. Right now, when we see these anterior hip approaches, all we need to work on is make sure you have the motion to get the job done.
Absolutely.
We don't have to worry about causing some kind of trauma to the hip joint itself because it's so stable and the surgeries are so good now that we just really just treat you like a normal patient, just getting your motion back and your strength back without having to worry about causing damage or anything like that.
Yeah, and I'm just going to add one thing on that. And from the surgeon perspective, just kind of give you more specifics, I'm just going to compare the old-fashioned way we did hip replacements to the way we do them now with the anterior hip replacement. We eliminate a lot of potential complications by doing it that way, okay? Number one, like we discussed, is dislocation. The biggest, strongest ligaments of the hip are actually in the back side, but when I do the surgery from the front, I don't bother those ligaments, and that's why dislocation is so much less occurring. The other thing is when I'm doing an anterior hip replacement, I'm doing the surgery under an x-ray machine. Versus when I did it from the back, I couldn't look at that under an x-ray machine. It would be the x-ray done after the surgery while the patient's in recovery. But since I have x-ray, I can position the implants nearly perfectly so that an implant position is not the reason for a dislocation. So knock on wood, I've never had an anterior hip replacement that's dislocated because I know what it looks like when I'm in surgery. I know what it's going to look like when the surgery's done, and I know that I've done a very good job because I have something showing me on x-ray that I did a very good job. The other thing that anterior hip replacements does, one of the other complications of different surgeries from other positions is leg lengths, okay? You can have a shorter or a longer leg when you do a hip replacement, but the benefit of anterior hip replacement is that since I'm using the x-ray machine, I can actually take an x-ray of the other hip that I'm not doing surgery on, compare it to the hip I'm doing the surgery on, take those x-rays and put them on top of each other, and I can get normally within a millimeter of the leg length of the opposite side. And that's a major reason for revision surgery if the leg lengths were off. And that'll cause problems with chronic pain, especially on the outsides of your hip, and just the risk that you need a shoe lift and all that. So anterior hip replacement has really made a big difference in decreasing complications that we saw in the past.
Yeah, nice.
Next question. So you've said I'll be able to walk after the surgery, but how will a therapist know about the barriers I face getting around at home?
Yeah, so what's nice about this, just like Dr. Gruber said, you're up and moving really early. So much that your hospital stay is not very long, and then when you're sent home, at KORT we have something called KORT Rehab at Home, or we call it our outreach services too. So what we do is we actually come to your house. We'll talk to you on the phone to try to figure out what kind of barriers you're dealing with, but the best way for us to see it is to come to you. And whether like this, and times where it's a little bit trickier to get out, you don't have to because we're coming to you anyways. And our goal with our Rehab at Home or our outreach program is to get you started to the point where you feel comfortable getting out of your house, and then we get to come to the clinic just like normal. But it's been something that's been really nice for our continuum of care. So once again, Dr. Gruber will send you over here for prehab. You do your exercises, you do your therapy for a little bit, improve your motion, and then we send you to Dr. Gruber. He does the surgery, and then we'll come to your house afterwards for outreach. We even have something called telehealth or telerehab, that if you're unable to make it to the clinic, and if for some reason we weren't able to come to you, we can still provide you that service by doing it over a video conference, and you can kind of show us around your house and show us some of the barriers that you may have. But it's just we're living in a time where we're able to offer you so many different ways of service to take care of you, to make sure you get the best care and you get recovered as fast as you can.
Yeah, and I would just say that, I've seen people treated multiple different ways after the surgery. One is either in the outpatient perspective or the KORT at home, and I really don't see any difference in the overall outcome whether you did one or the other. So if you're more comfortable with KORT at home, then that's the way you should go. And I think in light of COVID, that's a great valid option for a lot of my patients.
Yeah.
So it's worked very well.
Yeah, thank you.
Can you explain the recovery time and process and what my physical therapy will entail after surgery?
Yeah, so I'll let you start with just general recovery time. Yeah.
So just ballparking everything for the typical patient for an anterior hip replacement. We do the surgery. When you go home, you'll start therapy. Most of any discomfort from the incision, most of that's gone in about 2 weeks. Okay, people are doing really well by 2 weeks. The other thing about the incision is when we do that closure, we actually do a plastic surgery closure on that incision. We do all the closure under the skin with super glue over the top and a waterproof dressing. You can shower the same day I do the surgery, which is great. Okay, we have no concern for the incision. So I would say after that 2 week mark, when most of the surgical pain goes away, people are doing really, really well. And they normally will tell me, at the 2-week visit to my office for a re-x-ray to check everything and see how they're doing, they'll usually tell me their pain's much better by that point. Then I would say most of the soreness, if you do have soreness, is usually gone around the 6-week mark. I say about 3 months, 12 weeks is where people are pretty much about, I'd say 75, 80% recovered by that point. And I always tell people for any joint replacement, whether it's shoulder, hip, or knee, 100% recovery is always considered to be a year. But that's just really about, in a hip replacement, that's usually about 15% from 3 months to 12 months. That's the last 15%. People do very well very quickly in these surgeries.
You know, it's always amazing when people come in here and they feel a difference in their pain immediately. And everybody says, I can take this post-surgical pain. It's way better than our arthritis pain I was having before. And his timeline matches up. Usually when we see patients, you know, at max, we're seeing them to that 3-month mark, but a lot of times they feel better at the 6-week mark. They're getting back to their exercise, they're getting back to work, and even some of these heavy labor jobs. You know, so it's around here we have a lot of people who work in distilleries. And just because you have hip replacement, it doesn't mean you can't go back to work. You know, these people want to go back and continue to be a part of their community. This allows you to do that. Some of the things that we see that are probably most difficult early on is flexing or bending your knee and your hip up towards you. Because that incision, it gets a little tight, you know, just because we want that to scar, we want that to be a really good solid and have a good incision. So we lose a little bit of that flexion, but that gradually comes back. We don't have to really push and make things uncomfortable because that comes back with time. And we do some light stretching, and that helps you like tie your shoes or even just sit comfortably. And then once you get that, everything else starts to flow really, really well.
Yeah, and I think, you know, what you do for a living really dictates, too, how fast you're going to go back to work. If you have a job that's more sitting, you're probably going to go back within a week, okay? If you've got a job just doing basic walking around an office or even outside a little bit, you know, I've got people sometimes that go back and do some light duty around 2 weeks, okay? By 6 weeks, they're definitely back at work. If you're in a heavy laboring construction, then we're looking, you know, 6 to 12, because then 12 weeks, because we want you to have all your strength back, because you need it to support the hip and the rest of your body. But really, what you do for a living dictates how fast you're going to get back.
Sure.
The next question, what happens to my right hip if I get my left hip replaced, or vice versa? If I have surgery on one side, do I need to have it on the other?
Okay, so first of all, I would say it depends on what the other hip looks like. A lot of times people have arthritis on both hips. That's more common than having arthritis on one hip. So what I find, if someone doesn't have arthritis on the other side, then normally they're doing great. They're not having any pain on either side, and life's good, okay? But if, say, someone has a severe arthritis on both hips, what I'll find is that once I fix the one hip and that pain goes away, people's brains go right to the next hip and they start realizing how much that one hurts because the other one doesn't have the pain. And sometimes that ends up being a second hip replacement sometime down the road. Sometimes people want them both done, and that'll be as soon as normally 3 months after the first surgery, or sometimes it might be 5 years. It just depends on how well someone's doing afterwards.
Right.
All right, the last question. Will my hip replacement last forever?
So I cannot tell you it will last forever, but I gave some time frames. We currently tell people on a typical hip replacement and done from an anterior approach, and it can be done other ways too if they were put in very well, a ceramic ball and a plastic cup, which is kind of the mainstay in today's day and age, okay? We're expecting about a 30-year lifespan on that hip from what we're learning from the science that's been done on these implants. If we have a ceramic on ceramic, that's sometimes we're telling people it's a potential up to 40 years. They don't last forever, but they last fairly long. And that's kind of why we typically want people's ages within line. We try to push people to an older age if they're very young so that we can hit and say, hey, average life expectancy, hey, you're going to live to 85 years old. If you have the surgery done and you're 60, it's probably going to last the rest of your life. So we try to get you as far as we can before we really need that replacement for quality of life.
Yeah. It's nice, though, to have that option because I've had some younger patients of yours who already dealt with this pain for 5 or 10 years, and they're really losing their quality of life. So you're able to give them 30 or 40 years of really good quality life because their hips moving so well and they feel so good. And that's amazing because just even 10 years ago when I first started practicing, you didn't see that. You didn't see anybody in their 50s and 40s having a hip surgery because it would fail and it wouldn't last. So it's come a long way.
Yeah, there's no question. I mean, if you go back, say, 20 years ago, I mean, I think the discussion was this might last 15 years, maybe 20 years in the best case scenario. But a lot of people wore the plastic out, and back then it was actually a metal ball in plastic. That plastic sometimes will wear out in 15 years. And then that's a revision surgery. And revision surgeries are a completely different thing. So our goal is to make these last as long as we can so we never have to touch that hip again.
Yeah. You know, it's pretty exciting to see what's happened so far with hip replacements. And I'm sure,
Absolutely.
you know, one thing I like about Dr. Duber is he's never complacent. So if there's some way that he can improve, or the surgicals, the different surgeries everything improves, he's learning. Like, he wants to be the best to provide you the best. And that's why we really have a good relationship with him, because he makes our job easy and he takes care of our patients. And that's why we trust him.
Yeah, I think in any medical field, whether you're an orthopedic surgeon or physical therapist, you have to be a lifelong learner. So you have to always be looking what's new, what's innovative, what's going on. I think when you become stagnant, you're not looking at what's new. It's a really disservice to your patients.
Yeah.
So just for example, anti-hip replacements. I think there's a lot of studies that are showing that that's the way we should be doing them. People do better, they recover better. So there's no question. Once I learned that, I was immediately on that.
Oh yeah.
All right, thanks so much. Do you all want to tell people how they can contact you to schedule an appointment?
Yeah, I'll let you start.
Yep, so you can just contact us here. It's St. Joseph Health Orthopedics. We're right attached right next to KORT. KORT can give our contact information, and we'll include that contact information on this Facebook video.
All right. And then you can call us at 1-800-645-KORT. We have an online chat. If you don't have the ability to talk to us or call us, that's our centralized scheduler. So this can be for any KORT location. It doesn't have to just be Bardstown. But then, yeah, once again, we can schedule appointments that are in person, in your home, or even through video chat. So right now, we're trying to make sure we're able to offer you any way possible to take care of you.
Perfect.
Yeah, thank you guys.